Today, I'm reporting 7 new cases of COVID-19 in the province, bringing the total number of confirmed cases to 998. We currently have 5 individuals in hospital. 2 of those are in ICU. We have 661 of our total cases can now be considered to be recovered, so about 2/3 of our cases, which is really good news. We have 31,541 Nova Scotians who have been tested and have had negative results. As I started yesterday, I'll now be reporting active cases only of COVID-19 in licensed long-term care homes and unlicensed senior facilities, instead of cumulative. It's just that the active cases gives a much better sense of what the current disease activity might be in our residential care settings. We have 3 licensed long-term care homes and unlicensed seniors facilities with active cases of COVID-19. Northwood in Halifax has 160 residents and 51 staff with active cases, while 2 other facilities each have 1 staff member with an active case of COVID-19. We do know that several Northwood staff have tested positive in the last few days, and we are doing an intense review of each of those cases to understand potential exposures for those individuals, what would be the likely source of them becoming infected. As part of that review is a deep dive into our current infection control and cleaning protocols to make sure that everything necessary continues to be done. Moving on to testing, the QE2 lab processed 764 tests yesterday, so we still have a lot of people being tested, and fortunately very few positives. I do want to continue to remind anybody in Nova Scotia, no matter where you live, no matter where you may have been, that if you have symptoms that suggest COVID, so those are fever, new or worsening cough, headache, sore throat, runny nose, if you have 2 or more of those symptoms, we want you to reach out, do the 811 online assessment if possible. If you don't have online access, calling 811, and they'll take you through a more detailed assessment and direct you to testing if and as necessary. It continues to be important that a key part of our strategy is broad testing and identifying cases as early as possible in their course, and then following up with strong public health action around isolating cases, identifying and testing and quarantining all of their contacts, minimizing the opportunity for the virus to continue to spread. And so I think it's an important reminder that while we continue to see the bulk of the disease activity in the central zone and the HRM area, that it's important that all Nova Scotians, no matter where you live, that there is still the significant potential that COVID-19 could appear in any one of our communities. That if we let our guard down in any one part of the province, that potentially gives the opportunity for the virus to come back and to spread within your communities. So we need to continue to focus while we're talking about a recovery strategy, and we'll be talking more about that in days to come. It's critically important that we continue to also focus and not let our guard down, not weaken our resolve to prevent the spread of the virus. So we all need to continue to focus on good hand washing, not touching our faces. Those steps ultimately are what prevent us from infecting ourselves. We need to focus on, while we opened up outdoors, we actually want people to get out and be outside, but not together, only within your household group. It's not time yet to be getting together with people outside of your household group. So maintaining that social distancing, minimize, essential shopping only, all the things we've been asking you to do while we slowly open things up. It's important we still continue to protect ourselves and protect each other.